About miasms and their effect on relief of chronic diseases. Of course, we have to know what it means, but as we interact with Dr. Amadi this morning on Health Plus, we would have a deeper and clearer understanding of the topic for today. Dr. Amadi, good morning. Thank you for being here again.
Good morning, Sage. Good morning, Lagos. Thank you for welcoming me.
Of course. So, the topic, miasms and the effect on relief on chronic diseases. So, first things first is a no-brainer. What exactly are these miasms before we start to see how influential it is in taking care of chronic diseases?
Thank you very much. Once more, thank you, Lagos, and good morning. It's good, the growing interest in homeopathic method of therapeutics is very encouraging because as an alternative medical system, you can see that there is hope because one does not put all his eggs in one basket. So homeopathy is growing as it has grown worldwide. Wherever there is development, homeopathy is there, as practiced in London, in America, in India, in Germany, everywhere. So it has come to stay also in Nigeria. We have actually, as Sage said, treated our comprehensive computer analysis, how it is done, the method of doing it, the importance. One of these days too, we are still going to do the advantages of comprehensive computer analysis. But as the presenter rightly said, today we want to go into miasms. Miasms simply mean those secret causative agents of diseases that impede recovery. Miasms come to be in place, firstly, when the founder of homeopathic medicine, Dr. Samuel Hahnemann and his group, when they saw and they were confronted with certain difficulty in relieving certain health conditions and challenges of human beings. Especially treatment of acute diseases were very easy in their hands. People could be treated of their acute cases, their fevers, the malaria, the typhoid, the vomiting, and all the rest of them. But when it came to chronic diseases, the so-called terminal cases as we know them today to be, Dr. Samuel Hahnemann and his group discovered that it was a bit difficult to treat a case of, say, high blood pressure. He discovered that cases like diabetes mellitus was proving stubborn to his therapeutics. He discovered that cases of, say, cancer, carcinoma, was very, very stubborn to the treatment methods. He discovered also that these cases today of immune deficiency syndrome, human immune deficiency syndrome, was not amenable because of certain things. Then they questioned themselves, what could be responsible for these delays? What could be responsible for this difficulty? What is responsible for this incurability or inability to manage such diseases in their forms? So they tried to investigate, and when they investigated, they were questioning themselves. Could it be that there were not enough homeopathic medicines to take care of these cases? They reasoned and said no, they have more than 2,650 homeopathic remedies. It cannot be because there are not sufficient remedies. They reasoned, could it be that the law of similia similibus currentur was no longer effective? For your information, sooner or later we're also going to treat the law of similars so that we understand better. Could it be the law of similars is no longer effective? The reason that said no, it has been a natural law that when dog bites a human being, that the best way to relieve that person is to use the poison of dog. When snakes bite human beings, the best way of relieving that person is to use the poisons, the venom, which today we call vaccines. So these things, the law of similia similibus currentur, therefore, can never be wrong because it is natural. So what could be the reason? Now he figured with his scientists. We have Dr. Edison, Dr. Harrison, Dr. Nash, Kent, the man who wrote Kent Repertoire, one of the biggest miracles in homeopathic therapeutics, and Dr. Bonnie Hansen. And they came up with a real good thing. And that is that there is a secret something that impedes the recovery of individuals who have these so-called serious health challenges. They discovered that these things can now be called MIASMS. So by definition, miasm is secret causative agent of disease that impedes the recovery of the patient. And in that case, that is why the cases of diabetes, high blood pressure, cancer, carcinogen, human immune deficiency syndrome, and all those so-called big cases were not possible. So they discovered and classified them into 4. So the miasms you have known said now that it is the secret causative agents of disease that impedes the recovery of the patient.
Now, are there types of these miasms? Because I know that even for diseases, there are different classifications. Ones that affect the immune system, maybe ones that affect the reproductive system. There are different classifications. And I would like to think this extends to miasms as one of the causative factors as well. So are there types or maybe classification of miasms?
Yes, of course. Dr. Samuel Hahnemann discovered that there were principally 4 miasms that impede recovery of individuals from their maladies. These miasms were classified as 1, Sora. The second one is called psychosis. The third one is called syphilis. And the fourth one is called tuberculosis. It was discovered that these 4 are quadruplets of the same mother that are in charge and the causative cause, the causative factor of all diseases that mankind suffer. For instance, the first one, Sora, they investigated and saw that all diseases of the skin, all problems that originated on the skin, call it the psoriasis, call it the itching, call it whatever, they are happening on the epidermis, the body, external body. And when these diseases, when these skin problems, so to say, are not treated with the correct medicaments, then they are being forced, by force of hard drugs, by force of wrong medication, they are now suppressed into the body. When they are suppressed into the body, it will look as if that patient has been healed. But then, in this case, in this stage now, homeopaths say this is called latent Sora. In latent Sora stage, take for instance your eczema on the skin that was topically treated wrongly and now suppressed into the body viscera, has not yet disappeared. It's now competing with various inner cells of the body, competing with them, distorting their movements, and it looks as if the human being is very healthy, but it's not healthy. How do you know? One day, Dr. Samuel Hahnemann discovered that this man that seemingly looks all right and okay is struck by a serious message, a serious information, a serious excitement, positive or negative, emotional information, positive or negative, fright, joy, or anything, or even a slight accident, maybe falling down from a bicycle, or even dislocating while walking on the street, and then he is down. The moment he is down, these homeopaths discovered that then this latent Sora, like the sleeping snake, will now wake up when the body vital organs are low. And when it wakes up, it starts forming different diseases. Now people have diabetes mellitus, people have high blood pressure, people have immune deficiency syndrome, people have one thing or the other. If the physician now is able to find out that originally this case is from Sora miasm, it's now possible to use medicines known for Sora to handle such case. The second one, psychosis, simply relates to all forms of problems that originate from man-woman sexual relationship. When men meet women, sometimes if there is any form of infection, call it gonorrhea or whatever, if this infection is not properly treated with the right medication, our colleagues in the orthodox system will simply run a test and find the antibodies that are responding to such affection, and then maybe they call them antibiotics that originally suit them. Now, for your understanding, if for instance the particular bacteria for the infection was responding to, say, procaine-penicillin, and now you did not use procaine-penicillin, you use something like Septrin. Dr. Samuel Hahnemann says that this wrong application, which is not based on the right laboratory finding, that this particular procaine is supposed to be the one that will attack this, but now you use this, that it will now cause that disease to be suppressed inside the body. So likewise, in homeopathy, we say that when the wrong medication is used, for instance, people taking wrong injections, instead of treating harmoniously and with the law of similia similibus currentur, the discharge of pus is suddenly cut off. The man does not see pus any longer before his urination. The woman does not see discharge any longer, but they are suddenly cut off, not properly treated. Hahnemann says that this is not proper relief, that those things are being forced into the inside body viscera, in the word they use as suppression. When they are suppressed this way, the human being is walking around thinking that it's okay, but alas, that venereal infection is still active inside. Now, sooner or later, he now begins to experience what we call boborygmy. That means that the intestines will be making noise. He will be hearing prr, prr, as though they are worms, as though he has eaten wrong things. This boborygmy, the patient will go further to look for more stronger medicines that will stop those noises in the tummy, because he's embarrassed sometimes in the public places, and he finds another stronger medicine to take. Behold, the boborygmy may now still be suppressed deeper into the body because it is not yet relieved out. And when it is suppressed, so sooner or later, the homeopaths discovered that there will now be what we call cauliflower growths. That is around the genitals of the man, around the genitals of the woman. Don't misunderstand me. By this, I mean the reproductive areas, the reproductive organs of men and women, around the body viscera, between the labs and the organs. You will now see cauliflower growths that cause itching. The man will itch and scratch and scratch. Some people will put hand in the pocket and their scratching is so sweet. In the bus stops, they are no longer aware of passing buses. The woman will put hand in the gown and scratch and scratch. They call it cauliflower growth. And it's dirty. And the fingernails are dirty because they are filled with this cauliflower growth and smells obnoxiously. At this stage, it's not still well suppressed. Until this man is embarrassed, he may now go for curettage, either to remove those excrescences or to use more powerful medicine that will put them inside. When they are now put inside, it's now called suppressed psychosis. When it is suppressed this way, any slightest thing, could be bad information, could be accident, could be anything. When the man is weak, the vital organs are weak, then the suppressed latent psychosis suddenly rises up, giving rise to different cases, different troubles, fibroids of the uterus, giving cases, carcinoma, giving cases, hotness of body, moving sensations in the body, and different things, diabetes mellitus, because the glomerular filtrate will no longer be filtering well, or sometimes many organs will not be functioning well, and that is psychosis. Well, I don't know, Sage, if I'm doing it. The third one is the
syphilis.
The syphilitic miasm. The syphilis miasm, many people know. It could have been called a venereal disease, but because it's more superior, it has its own class. We have syphilis type 1, syphilis type 2, type 3. In syphilis, many people don't even understand that they have syphilis. And when they have this syphilis, either contact from such intercourse with their partner, then at the stage that the partner who was originally affected had it, he now also takes it. There will be a pimple-like eruption on the genital of the man, on the reproductive organ of the man or the woman. But one character of this pimple-like eruption is that sometimes and most times it will disappear on its own accord without you treating it. Sometimes these pimples will appear on the forehead of a young girl or a young man, maybe 3 or 4 in number, and refuse to respond to any treatment. When they are forced to go in, then it becomes suppressed, and in this case is called latent syphilis. It may now progress to that point that it can cause some ulcerative lesions in the in the groin of men and women, and sometimes producing gomata or swollen like rubber like eruption in any part of the body. It could be the groin, it could be the armpit, most places in the private sides of the body. And this case, it is now the 3rd stage. Most times people don't know that this suppressed syphilis this time, the man thinks he's healthy, but before you know it, sooner or later, the erectile muscles are no longer working. The women, the reproductive organs are now contracted. Even the little finger cannot even penetrate the body of the woman. Even the man cannot have erection, even though no matter how beautiful the partner is. And these things happen. The final one is the one they call tuberculosis. And this miasm has been very, very dangerous. In fact, many times people cough and cough and cough, and they say if it's not amenable to common medicines, they say it could be tuberculosis. Not knowing that tuberculosis as miasm may even present without coughing. Sometimes there could be tuberculosis of the intestines, of the gastric organs, tuberculosis of the hepatic cells, tuberculosis of the brain even. Tuberculosis can be very, very varied and very numerous. Homeopathy discovers that tuberculosis has been responsible for many ailments without people knowing it, because people tend to think that when they have tuberculosis, it's only when they are coughing, not knowing that some people are losing weight steadily because of tuberculosis and they are not aware of it. Some people are having one problem or the other without knowing that this is what the problem is tuberculosis. Some people are sweating in their night sleeps because of tuberculosis. Some people have loss of appetite, losing weight, losing their color. So these 4 miasms are in homeopathy what are responsible for diseases. And then I will be able to tell you when I come back the effects and the implications and the importance of them right now in our modern day.
Right. Finally, though, would you like to establish, like, how exactly does understanding this miasms, how is it relevant to treating chronic disease? What part of it is studied? How do you infuse the knowledge you get from studying it into taking care of the chronic diseases? Do you use some of the theories you've spoken about in the past? Do you extract tissue sample studies and then make a vaccine from it? How exactly is it relevant to the practice of homeopathy?
Thank you very much. The importance of miasms cannot be overemphasized. These days, you see many people claiming that they are HIV positive, HIV-1, HIV-2, and all the rest of them. There have been arguments before whether there was something like that or not. Science has proved that yes, there is something like that. And all the bodies are helping. The World Health Organization, the Ministry of Health, even the State Ministry of Health, everybody is helping. The antiretroviral drugs, they are all helpful. But the knowledge of miasm helps the homeopaths to classify the diseases that are presented to them, the health challenges that are presented to them. Sometimes many people have moving sensations in their body. Sometimes people have hotness of their body. Sometimes people have unnecessary emaciation and loss of weight in their body. Sometimes people have strange pains in their body. By simple radionic analysis, that is the comprehensive computer analysis which we did some time ago, because one of the aphorisms in homeopathy states thus, according to Samuel Hahnemann, he said that the unprejudiced observer, in bracket physician, well aware of the futility of transcendental speculations, bears nothing in mind in any case of disease presented to him except the totality of symptoms. That is aphorism 4. And that means that irrespective of your power of penetration by way of concentration or otherwise, irrespective of whatever you know in the tradition, that transcendental speculations do not come into science, that you have to analyze each and every organ from head to toe. That helps you to know the totality of symptoms. By knowing the totality of symptoms, it is now possible for you to know if this is originating from Sora miasm, or from psychosis miasm, or from syphilis, or from tuberculosis. In fact, this knowledge has been the reason why homeopaths succeed in many cases where many people think is impossible. This is one of the things that is done there. In this case of immune deficiency syndrome this time around, it is now possible to check the accumulation of Sora in an individual. Sometimes a particular human being will have some Sora, have some psychosis, have some syphilis, and have some tuberculosis. How will that person bear? The only resultant effect is that the immune system that is carrying the body, the main vital principle that is the owner of the body, being shouldered with the responsibility of carrying all these strange elements, these strange enemies, will simply succumb, and then we say that the immune system is down. By knowledge of miasms, therefore, by removing Sora first, removing syphilis, removing psychosis, removing tuberculosis, you will see that there may not longer be any need for anybody to say, this is a very serious problem I may not have any relief from. This is one of the advantages. And there are a lot more advantages we can do.
Right. Probably in the next session, we can now break down the advantages and disadvantages and maybe go through some of the miasmatic theories amongst other things. But before then, please, how can people reach you? Your phone number, your physical address, or whatever information you think people would need to contact you for consultation.
Yes, it's good for you to access our YouTube channel, Boundary Specialist Clinic, in brackets, homeotherapy. So you can subscribe there and maybe read up your area of interest. And then apart from that, we are on mobile phones, number 080-222, that is 222 41516, and that is 080-222 41516. We are also on 0803-707-2231. That is 0803-707-2231. And you can also reach us through our Dorobuchi Foundation line on 0809-921-6000. That is 080-9921-6000. These are the numbers, and our email, you can reach me on dorobuchigodspower@gmail.com.
All right. Thank you very much, Dr. Amadi, for being here. The concluding part of conversation on miasms would continue hopefully next week on Health Plus from 10 to 10:30 a.m. We're about to get to the final phase of Health Plus this morning, and we will be talking about hepatitis. As you know, we're commemorating World Hepatitis Awareness Day, and also trying to get people to screen for hepatitis, and also educate us on the availability of vaccines and other treatment and management methods of the condition. My name is Sage Babalola. Please don't go anywhere. When we come back, we'll open a fresh conversation on hepatitis.